Hi, I'm Dr. Michael Miyazaki, and today we're going to talk about aesthetic dentistry is everyday dentistry. One of the things that I hear from doctors as I go out and talk, and this picture here is from a lecture that I did this last weekend. I think I was trying to fly, but I talk to doctors and they go, you know what? I don't do a lot of aesthetic dentistry. My patients don't want aesthetic dentistry. And so what I want to do is I want to kind of change the thought on that aesthetic dentistry is anything but everyday dentistry. Every day, everything we do, we have to do aesthetic dentistry. Nobody says make my tooth ugly or my smile uglier, right? Everybody wants to look better. And I just think there's so much potential in our practices if we really focus on aesthetic dentistry. So there are some practices out there, and I talk to the doctors, and they go, I'm really struggling. I'm having a hard time making ends meet. And I'll ask them, well, what kind of services do you provide? Do you provide fillings? Do you provide crowns, or do you provide other services like aesthetics, implants, TMD, airway, whatever? And these doctors will say, well, I don't do any veneers because I don't have any patients who want aesthetic work. One of the things is with that is we are the dentists, the clinicians, we have to be able to see the possibilities. And then we tell the patient, you know what, you've got teeth that are worn or you've got teeth that are dark and crooked. And what I can do is I can straighten your teeth out, I can whiten your teeth, and then maybe I could enhance the contours of the worn dentition with veneers or whatever the appropriate restorative work is. And if we start to tap, if you're a clinician that has not tapped into any of the aesthetic work with your patients, and now you can see the work and the possibilities that work can provide, you're going to change lives. And if you know how to do the work, then you're basically sitting on a gold mine. Why is that? Because aesthetics today isn't just about veneers. It's about whitening the teeth. It's about moving the teeth. It's about restoring the teeth, replacing teeth with implants, and then how the teeth function and a TMD kind of function. And if you train yourself to be able to identify those needs and then communicate with your patients about what you can do because you've been trained to provide those services, I think your practice is going to thrive. Now, one of the things I do see is with all the advancements in dentistry, we have a lot of patients who come in and they're 20, 30, sometimes even 40 years old, and they have no dental needs except maybe some maintenance, hygiene. They don't have cavities, they're not grinding their teeth, maybe they need a night guard, but basically they're in good restorative health, periodontal health. And if they're in good restorative and periodontal health, they're probably not going to be missing teeth. But some of them have worn their teeth down, or they're drinking lots of wine or coffee and their teeth are dark and they just want whiter teeth. And you whiten their teeth and they go, wow, I love my smile because I have whiter teeth now. Well, now they're crooked. What would I do now? Well, now I can straighten your teeth because there's all these clear aligner systems out there. And now they've got whiter, straighter teeth, and then they start to see little chips and the wear on their teeth. And they're asking you next, what can I do? And if you can do veneers, let's say, and you feel that that would be the best thing to do for that patient, then it's win-win. So what you have to do is you have to be prepared. You can have a fire extinguisher and you hope you never use it, but you have it there just in case. And that's what you need to do is you need to invest in yourself, but the education so that you can do aesthetic dentistry. And if you can do aesthetic dentistry, when you get that patient that comes in with aesthetic needs, you're like, I can do that. So you have to be trained to be able to identify, and that comes down to smile analysis, to look at someone's smile and figure out maybe what's not right. Because sometimes patients will come in and they'll ask you, I don't like my smile. And I'll ask them, well, what don't you like? And they'll go, well, I don't know, but I just don't like my smile. And then you have to be able to look at their teeth and go, wow, well, your front teeth are really square because they're so worn down the edges. They look nicer, I think, if we made them a little bit longer. Or it could be just a color issue. You're right. Your teeth could be a lot lighter. Let me show you the shade tab. So here's where you are, an A4, but you should at least be able to be maybe an A1 or a B1 or maybe a bleach shade. So what you have to be able to do is identify the possibilities, the opportunities the patient could have, and then your hands have to be trained to provide that treatment. So maybe it's doing veneers. Well, you need to understand how to prep the teeth for veneers and hopefully to do the most conservative type of veneer treatment that's possible because that's always better for the patient. And then from that, your heart's going to feel the joy because I will tell you, when you do an aesthetic case, and one of the reasons that brought me up to do this subject right now is This last week, I did a whole presentation kind of on comprehensive dentistry, which included aesthetics. And then just last night, I was with a group as part of our live patient hands-on program talking about aesthetics. And we had a group that last month we just finished the cases up. So we did hands-on experience prepping the teeth, and we did a hands-on experience doing the cementation of all the restorations. And when the patients got done, they were all really happy. We had men that were crying, that type of thing, because they were just so happy with their smiles. So we finished those cases up about a month ago, and last night we had our follow-up meeting, our graduation, and the doctors were talking about the experiences. You know, some of the doctors came in not doing any veneers, but since they took the course, now they're doing more treatment planning of aesthetics, and it has changed their practice. Other doctors talked about how they had patients that came in, been longtime patients, but they never saw the opportunity that they had with this patient improving their smile with veneers, and now they've done the veneers, and how the patient's lives have changed, and it really changed the clinician's life. So that's why I feel the discussion on aesthetic dentistry is an important discussion to have. So as you learn more, you're going to see more, and then you're going to do more. So those doctors that tell me, I don't have patients that need veneers. I have doctors when I'm doing implant courses that say, well, I don't have patients that need implants. Or when I'm teaching how to move the teeth, I have doctors that say, I don't have patients that need to move their teeth. And I'm thinking, we all have patients that have crooked teeth. We all have patients that are missing teeth. And we all have patients that could benefit from veneers. So this is some shots from the course that we do. So I'm teaching a course on aesthetics. We are in there. We're working with the doctors, live patient, and we have instructors. The one in the center, that's Dr. Jack Griffin, very well known throughout the country. Dr. Smurthwaite on the far right hand side, and we have other great instructors that are helping us out. And as we do these courses, we work side by side with the doctors to teach them prep design and talk about multi-unit cementation. And it's really fun. What's one part of the dental profession that I really love is the teaching part. And by taking these courses, what we teach the doctors to think about is not just tooth type of dentistry. You know, and it's just not tooth, but it's teeth. So by looking at the mouth as a large unit, we don't look at a tooth, but we're looking at the teeth. So we're looking, instead of one unit, we're looking at 28 units. And I think that's an important part of what we do, is we're trying to see the bigger picture. Because when we look at the bigger picture, we can fix more things. If we have a patient that's got a worn dentition and it's causing TMD, we might be able to fix that by restoring their teeth aesthetically. But aesthetically, in my mind, means conservatively. And so I think that's the win-win. So why should you even think about doing aesthetic dentistry? Because it really is fun. You know, we're working in the front of the mouth, not usually way in the back. I think in my mind, everything's aesthetic. If I do a denture, it better look aesthetic. If I do an implant, it better look aesthetic. And this type of dentistry changes patients' lives. When you get done with this, they're thrilled, they smile more, they feel better. I've had patients tell me they felt so good after we did a full mouth aesthetic case that they went out, had more energy. I had one patient who sold multiple companies then for millions of dollars, and he attributes it to his smile. For us as the clinicians, you can make a better living. You know, if you're doing a $15 or $20,000 case, the revenue return is much better for your time invested. So it can make you happier. One, the patients put more value on this. You could do a crown and a root canal procedure, and the patients don't always see the true value. You know, they give you the money and they say thank you because they're out of pain. But that's kind of where the enjoyment of that procedure ends. Whereas with the smile, every time the patients come in for their hygiene visits, they're saying, Doctor, I just love the smile. I love the way you changed my life. And so it makes us feel better because we kind of hear that constant positive dialogue. And you know what? As you go through this, you make friends with these live patient treatment programs. Because we're kind of in the trenches together, we kind of bond. And so these courses are really fun. So what I would encourage you to do is look for one of these courses um, somewhere near you. The aesthetics, I don't really think of selling aesthetics. Like when patients come in, I don't try to sell them 10 units of porcelain veneers. What I try to do is I try to educate them where they are, what the health of their teeth looks like, and I offer them sometimes, when appropriate, that porcelain veneers could satisfy kind of their wants. So how does that work? I need to listen to them. And we have intake forms that ask, do you like the appearance of your teeth, your smile? And so I don't have to meet the patient for the very first time and say, wow, you've got really crooked teeth, ugly teeth, right? They're dark, they're crooked, they're worn. But if the patient checks off that they don't like the appearance of their teeth, and it says, if not explained, and they go, well, my teeth are worn, chipped, dark, and crooked, then everything I say after that is just a solution to the problems that they're presenting to me, right? So I'm not trying to sell them. They're telling me what they don't like, and then I'm trying to offer them solutions to the things that they see. And the other good thing about this form is it asks the patients questions, so they have to look at their smiles in a different way. I call it habituation. You know, that's like when we walk into a smelly area. Well, if that smell is constantly there, after a while we don't smell it, right? Our nose habituates to that. Or if we're in an area that has constant sound, maybe like white noise, well, we walk in and we're really aware of that noise, and then after an hour in that noise, we just kind of tune it out. So it's kind of like oral habituation. So having a form that asks the patients, you know, are there things that you don't like about your smile? Are your teeth crooked? Are they chipped? Do they protrude? Is there wear on the biting surfaces? Are there any old fillings or dental work you don't like looking at? Now the patient's going to look closer at the smile and say, well, yeah, you're right. You know, I got these things back here that are black. And then when I walk into the room to do their exam, I just ask them, well, you checked off that there's some old fillings you don't like to look at. Which ones are those? I go, this black one that's down over here. Oh, yeah, I can see that. Well, a solution to that is maybe a tooth colored filling or whatever is appropriate for that patient. But no longer are we saying, oh, you need to switch that dark filling out, and I can do that with the tooth colored filling. It's kind of like salesy, right? I'm just identifying what they don't like and offering them a solution. So it's a lot softer. We do a lot of photography. If I take a photo of their smile and they've habituated to their smile, so they look at their teeth and they go, wow, you know, it doesn't really look that bad. It's the way it's looked for the last 20 years. But now I put the photo of their smile up on the monitor and they look at that and they go, wow, you know, the teeth really do look dark. They don't look even. They don't even look like they're aligned evenly. And look how thin the edges are. I can see the gray through the tooth because it's so thin there. And now what are they going to do? They're going to say, well, yeah, you know, where I see the tooth is kind of chipped there and it's really thin there. What are some things that we can do? So they're asking me, what can we do to keep their teeth stronger, to make them healthier, to make their smile nicer? So what a lot of times I'll do is I'll adjust the functional things. Well, you're right. Those teeth are thin in those areas. We can reinforce and strengthen the teeth, maybe with porcelain veneers. And one of the added benefits of that is your teeth are going to look much nicer. You're going to have a nicer smile. And so we can get into the benefits as we take care of the problems. And so what we're doing is we're building a gap because the patients walk in, they don't know what we can do. They can't see the vision that we can see as aesthetic dentists, right? And so when we look at a smile like the one we just saw, I can all of a sudden see white veneers going across with some nice incisal translucency and really brighten that smile up and repair all the worn aspects of those teeth. So we build a gap, you know, show them some befores and afters, show them what you can do. And then don't tell them how you're going to do it. You know, don't say we're going to take a 0.5 millimeter depth cutting burr to put depth cuts in, and then we're going to take a big fat diamond burr to remove those depth cuts, and then we're going to clean everything up. What you want to do is, you know, when we get done, your teeth are going to look stronger. They're going to be whiter. They're going to be in line. You're going to have a beautiful smile, and the beautiful smile is going to make you feel better. So we give them information because it kind of tells what we want to do, but it's really the stories. If you have stories, you know, I have another patient that we did veneers on who looked just like you, had the kind of the chipped teeth, and they were getting very thin. And what kept happening was every time this patient came in, we had to repair the teeth because they were getting so thin, they kept chipping more and more off. So we finally decided to do is we decided to do some aesthetic restorations that made the teeth stronger and improve the patient's smile. And after that, the patient never chipped their teeth and they felt so much better, not only health-wise, but about themselves because now they're smiling. So the stories build the value because who doesn't want to feel better? Who doesn't want to have a nicer smile? And if you can relate a story of a patient that you have taken care of to the situation that they have in their own mouth, then that's a powerful thing to do. So tell the stories because you're trying to build value. Because when they walk in, they don't know what to expect. And let's say they need 10 veneers. Let's say those 10 veneers in your practice would cost $15,000. What you have to do is you have to take them from not expecting to spend anything because they didn't know anything about what veneers were. And now you're going to take them from zero to $15,000 to spend, that's a large gap. And so what we have to do is we have to build value in that spend. It's going to make you feel better. It's going to make your teeth stronger. You're going to be more successful. Whatever you interpret is going to be the benefits for that patient, you need to tell them that because they've never done this before. So begin with the end in mind. We begin with our smile design, then we do our preparation of the teeth and temporization, then we'll do the multi-cementation, some final adjustments, and if we get a happy patient, they're going to refer more friends. And that's how this kind of begins to snowball, is you do one and then they just start referring their friends. And that is when your practice will begin to change, and you won't be able to tell me I don't have patients that want aesthetic smiles. So first determine what it is that they want. What's that perfect smile to them? Not to you, but to them. We have to then communicate that to the lab, and we have the lab that can create the work to create that smile that the patient wants. We then have to manage the patient expectations, and while they're in the temporaries, we have to make sure that they keep their gums clean. And while they're in the temporaries, we have to make sure that they do like the way the temporaries look. So this is just an example of often how we do this. The patient comes in, she's a very attractive patient, but when you look at her teeth, she's got some wear, especially on the cuspid, on the number 11, the 2-3. We have a diastema between the right central and the right lateral. So it's not really a perfect smile. So what we do is we take a model, or maybe you do an intraoral scan, and we begin to discuss the goals. So the patient wanted to have a nicer smile. You could see that her teeth were kind of worn straight across the incisal edges. She wanted a rounder, softer smile. So what we did is we figured out what the patient's goals were. What did she want? What color was she seeking? We then looked at her models to do the smile design. Then we ordered a diagnostic wax-up. With that diagnostic wax-up, the laboratory, I use Core Dental Laboratory here in Sacramento, California. They'll make a putty stent. From that putty stent, I call the patient back in, and we fill that with self-curing temper material over her dried teeth. I place a stent with that material over her teeth for about 2 minutes. I peel that stent off, and this is what we get. We just get an acrylic overlay. The thing I like about this acrylic overlay is one, the patient can see how the teeth look, and they can actually feel. So if a patient has diastemas, when they talk, the air goes through there. Now they can talk to you, and they can feel what it feels like when the air doesn't go through there. So it's a little bit better, I think, in my opinion, than like a digital mock-up, because the patient can actually see it and feel it and experience it. And it's very quick to do. So we have our pre-op situation on the left-hand side. We have our acrylic overlay over there on the right-hand side. You can see the teeth a little bit more round. And it's funny because with those proportions, the teeth don't look longer, but they just look softer. And you can see that this overlay, it's not super clean. I just take the putty stent off. I just clean up some of the flash and just let the patient take a peek at it. We don't spend a lot of time with them at this point. So most patients at this point, they like it. They're like, wow, when can I have this smile? And I tell them, okay, we'll take a look at the books. Now that value's there. Remember that gap in the financial part of the situation? Well, now we've filled that gap because they know what the benefits are going to be. They've felt it. They've seen it. They've experienced it. So then what I do is I take 1/2 of that acrylic overlay off. So we took off the right side and left the left-hand side, patient's left-hand side, so they can see the difference. We did lengthen the length of those central incisors, and yet it did not look longer. We closed up the diastemas. We took care of the wear and tear, like on the incisal edge of tooth number 11 or the 2-3. And in this overlay, you don't see that at all. In our office with this particular patient, we were doing an over-the-shoulder program. So we had other doctors watching as we did our preparations and our temporization and our impressions. And so that's what this is showing here, that we had the doctors watching us do everything. The patient was just we made the temporaries on the right-hand side, and after we made the temporaries, the patient had a chance to look at the teeth, even though she was still kind of numbed up, but we liked the way it looked. And the final result turned out really well. She had a really nice smile there. And the gentleman in the lab coat on the left-hand side of the screen, that's Gary Vaughn. He is the head technician at Core Dental Laboratory, the laboratory that I used for this patient and the case. Did a fantastic job because the way that this worked, it's a 3-day course. Thursday it starts, we talk about smile design and prep design, and then we actually do the preps with the patient there. We have to take the impressions usually by about 1 p.m., so we get about 2 hours to prep all that out and temporize. We take the impressions, and the lab takes the impressions hastily because they have to get the veneers made, not on that Thursday, but by Saturday morning. So they get basically one day. They get Friday to finish all the model work, to fabricate the veneers, and on Saturday we actually sat the case. So my hats off, because within 48 hours we get the whole case turned and inserted into the patient's mouth. Anyway, the patient was very happy. We were very happy, as you can see. And these veneers change lives. So what I ask you to think about, the kind of gist of this program today, is invest in your skills. There's no better investment to invest in yourself. And I think, we all have investments we wish we had invested in. Man, Apple stock or Google or Amazon, I wish we had gotten into those when they first came out, because we'd all be billionaires by now, right? We all have the stories of things we should have invested in. Well, I don't want you to end your career feeling like you missed out on an investment. The best investment I think you could make is investing in yourself. So I encourage you to seek out education if you aren't doing this type of work yet. There's a lot of programs all throughout the globe, and with some really great instructors. But just invest in your skills, because if you invest in your skills, you will do well in this profession. So I just want to say thank you very much. One of the things that I always bring up is we are building a community of like-minded clinicians trying to do the very best for our patients. That's, for us, I think, number one. And then we have to build our practices because we have to stay in business. And I think that the third thing that I really try to stress is we want to have fun. When I go to work every day, I'm just going out there to have fun. And I really enjoy what we do as dental professionals. So if you like this information in this program, hit like, because the message is basically invest in yourself. If you want to make sure you don't miss out on any other information, then please hit subscribe. Hit subscribe because it really helps us know that we're going in the right direction. And I look forward to seeing you in our next program. Thank you very much.